Hey guys, we're going to talk about Chapter 31, the musculoskeletal system. I got cold in my house, so I put a blanket on. Anyway, Chapter 31 starts out talking about some of the anatomy of the musculoskeletal system. I know we reviewed this just a little bit when I was introducing the chapter to you, and I talked about the importance of weight-bearing exercise to prevent osteoporosis, and talked about correct lifting, not injuring your back. Your book talks about smoking, and that is not good for your musculoskeletal health as well. As far as nutrition, everyone knows that you should eat cheeses, drink milk to help with your musculoskeletal health. Actually, sardines and salmon help with it also. To get what you need. But I don't know if I'm going to eat sardines. How about you? Salmon, yes. Sardines, no. So read through that section about your foods that are high in calcium as well in your book. Okay, causes of musculoskeletal disorders: trauma, bruising, strain, sprain, or fractures, poor nutrition and weak bones, inadequate protein and muscle wasting, malignant tumors, lack of estrogen, and causing osteoporosis. I had you look through your sections on diagnostic tests and procedures, and you did a homework assignment that went along with that, so be sure and read through that chart about your blood counts, immune test, erythrocyte sedimentation rate, serum protein electrophoresis. Know what it means to have decreased calcium, increased calcium, and what that means for a patient. If they have decreased calcium, obviously it means that they could have osteoporosis, and increased calcium value could mean that they have metastasis of cancer to the bone. Increased phosphorus can mean the same thing. Uric acid is associated with gout and increased uric acid, so read through those sections as well. Okay, a little bit more about your musculoskeletal system. Types of tissue are bone and cartilage. Voluntary muscles are attached to the skeletal framework. Tendons attach muscle to bone. And your skeletal system and your muscle system work together. If you hear the word fascia, that is a covering or enclosure for the muscle. And your brain is protected by the skull. Heart and lungs are protected by the rib cage. And there is blood-forming tissue in the bones, which we mentioned. So your skeletal system does give you your posture. It's protective, gives you your shape, and also stores calcium for the body. Some of these notes I have don't exactly go right along with your PowerPoint, but believe me, if something is on your test, I'm going to be talking about it. So, okay. Your muscular system, the heat production that's caused by movement helps you maintain your body temperature. And also your muscular system, another function is to return blood from the legs. Your bony tissue is composed of osteocytes, which are bone cells, calcium cytes, and collagen. Osteoblasts produce bone growth and repair bone. And vitamin A, vitamin C, vitamin D, growth hormone, and thyroxine and insulin are all needed for proper growth. Your skeletal system has 206 bones. It has two divisions, your axial skeleton and your appendicular skeleton system. And your axial skeletal system consists of the skull, vertebral column, and rib cage. Your appendicular skeletal system consists of your arms, legs, shoulders, pelvic girdles, and synovial joints. And when you hear the term long bone, that could refer to a bone that has a shaft and an end, which is called an epiphysis, like the femur. That is an example of a long bone. You have 8 cranial bones in your skull and 14 facial bones. And we already learned last test we have 3 auditory bones. Okay. In your thoracic cage, you have 12 pairs of ribs, including the sternum in the thoracic cage. It protects your heart, liver, lungs, and spleen. And your chest cavity expands for inhalation by use of the external intercostal muscles. Okay. Skeletal muscles are voluntary. They contract and shorten, and your muscular system has about 700 muscles anchored to bones by tendons. And the more a muscle has to do, the more of its fibers that contract. I know a lot of you guys are into exercise and fitness, and you probably really know a lot about that, about increasing the size of a muscle. And that is important to do while you're younger, because we talked a little bit about already that your muscular system declines as you age. It's harder to build muscle, and so it's important to build it while you're young. And you've probably already learned when you were studying the endocrine system that muscle, a large amount of muscle in your body helps you metabolize insulin better, so you have less risk for diabetes. And if you do contract diabetes, are able to control your blood sugar better the more muscle that you have in your body. Okay, now let's move over, talk a little bit more about aging in the musculoskeletal system. I just said you have decreased muscle mass and strength as you age, decreased elasticity of ligaments, tendons, and cartilage, decreased in intervertebral space. So that is why you have a few loss of inches as people age. So you see kyphosis occur when you see an older individual that looks a little bent over. I actually have a girlfriend who, she's a little bit younger than me actually, but I can already tell, has got a little bit of a hump behind her neck because she's having a little bit of decrease in her intervertebral space. She's a very thin person. I don't know, maybe she had not a good intake of calcium, I'm not sure, but as women in particular age, they are prone to that, osteoporosis, and need to be sure and get calcium in the diet or use a calcium supplement. As we age, there's a change in posture, your gait or your walking changes. This can cause impaired mobility and increased risk for falls and fractures. So make sure you maintain safety for your patient. Safety, always important. You're always going to have questions on your NCLEX about safety with your patients. All right, and when you are assessing the musculoskeletal system, you've got a really good chart in your book that talks about questions to ask your patient about the musculoskeletal system and pain that they're having, and you watch your patient. See when you are helping them out of bed and they're walking to the bathroom, or even when you get them checked in to get them admitted, or if you're working in a doctor's office when they're just coming in and getting up on the scale. Is that hard for them to do? Can you tell that they are having some mobility issues? Also with subjective data, ask them about any injuries, how or when they occurred. If they played sports, maybe they have injury from that. Their diet history, are they getting in enough calcium and vitamin D? Do they use a cane? Do they use a walker? And also inspecting their joints. In your homework, that came into play with the lady who was complaining of joint pain. Do you see any redness in the joints? Do you see any swelling? compare the limbs side to side. That's always a big thing that I do. If someone says, hey, can you look at my knee looks swollen. Compare the right leg and the left leg and see what they look like in comparison to each other. Do you hear any crepitation or grating? Have your patient grip your hands with each of their hands. See if they have good grip strength. Ask them to touch each finger for range of motion and see if they can do that or not. Okay. As far as diagnostic testing, I've got some more notes here. As far as a CT, that can be used to check the joints or vertebrae. Myelogram can be used to check the spine or spinal cord. And MRI can be used with or without a contrast medium and is also used to check the vertebrae. Okay. A few more. Look up arthrocentesis. I think you have a chart in your book also that has some explanations for different words, tests that you may not have heard in relation to the joints, but that is to evaluate the synovial fluid in a joint, arthrocentesis. Also look up in your book about a bone or muscle biopsy. The safety alert with that is risk for bleeding with a bone or muscle biopsy. Applying ice packs is always going to be a good idea for swelling. Monitor for bleeding. Check circulation. If someone has a diagnostic arthroscopy, which is where I'm having some knee pain, I don't know what's going on, I don't necessarily, hey, maybe I play tennis and I might have knee pain and they may not know, I may not have a specific injury, so they might do a diagnostic arthroscopy just to go in and same-day surgery setting and inspect and see what's going on. After that surgery, I am going to have to keep my legs straight for just a short period of time, do some straight leg raises to exercise the leg. But just after about 24 hours, I can return to some light activity after that with a diagnostic arthroscopy. Also have a note here for your calcium, phosphorus, alkaline phosphatase, to know your normal ranges for those for testing. Okay. Okay. In your chapter also, in chapter 31, there are some good instructions about lifting and turning a patient. Use gentle and firm movements. Get sufficient help and adequately trained personnel. So don't be afraid to ask for help when it is time to move a patient, okay? That comes a little bit easier once you get to know the people that you're working with, but definitely ask for help to move a patient. If the patient can help without damaging the diseased joint or limb, he should be encouraged to do so. So if they can safely help you with changing the position, getting out of bed, turning, whatever it is, they can help with that. Explain the procedure to the patient if they're not able to help, and instruct them to relax completely during the procedure. Interventions to prevent disability, gradual mobilization, exercise programs, proper positioning, patient and family teaching, and nursing responsibility is initiate and maintain measures to prevent complications. For example, I told you guys I'm helping out with this young lady. I say she's a young lady. She's only 42 who has Lou Gehrig's disease, and she's immobile. And she has, just over the course of a month, started wearing wrist splints for contracture prevention in her hands. And so that's something that's done to prevent complications. And Also, we're doing some range of motion exercises. Certainly when we are lifting her, we are trying to use really good body mechanics. Miss Wheeler and I are, to stabilize ourselves prior to lifting, and explaining to her what we're gonna do. She can talk to us, she can feel what we're doing, she just can't move. So she can guide us also as to how to help her as well. But we do the 1, 2, 3 lift with her. So depending on where you work, you're gonna use that more often in certain situations. Your book talks about immobility, just like I said, range of motion exercises. There will be a test question about that to prevent immobility. That's very important. And it also helps the patient to not lose muscle tone. Range of motion exercises do. Okay. Like I said, always recognize patients who are at risk for falls, and someone who's had surgery and is learning to regain their mobility. Set goals for progressive mobilization. If you haven't read about setting goals in a while, remember goals should be measurable, okay? So you might set a goal that your patient can walk to the ice machine in the hallway or something like that for their first time they get out of bed with their walk. I know physical therapy will be helping them out with that most of the time, but you're still going to have some test questions about setting goals with mobility with your patients. Okay, thank you so much for your attention. That's chapter 31.